Hi, I'm Jason Nichols, and I'm running for Congress here in the 2nd Congressional District of Oklahoma. This video is the third in a set of videos we're going to release between now and the election on August 28th to try to get you better informed about what my stances are on certain issues. We've talked about things already like infrastructure and Medicaid. This week, as promised, we're going to talk about Medicare. Medicare is a complex program. It covers tens of millions of elderly Americans or Americans who have permanent disabilities, even if they are under the age of 65. There are several parts to the program. They all have different numbers of enrollees, and we won't be able to touch on everything about Medicare in a video that will be about 3 minutes long. But we'll do the best that we can to talk about some of the issues that the program faces and how we might go about resolving those. First and foremost, just like other programs such as Social Security, there is a trust fund that is connected to one part of Medicare that does have a future date at which the trust fund will be depleted. And we need to address those kinds of issues, try to ensure the long-term health of the program because it touches and affects so many lives across the country and right here in the 2nd Congressional District. And there are flaws within the program. It doesn't do a very good job of limiting out-of-pocket costs for people who are enrolled in the various parts of it. For instance, I just recently read an article about a woman who ended up developing a certain type of cancer that is manageable and treatable, but the drug that manages the disease is actually very expensive. And the way that Part D of Medicare is set up, she was still having to rely on a private foundation to actually pay for the out-of-pocket costs because Medicare wasn't covering it. Those kinds of things need to be resolved. We can't have people who have taught, they're retired teachers, she was widowed and raised 3 children on her own when she was 40. Later in life end up having to be at the mercy of ever-increasing pharmaceutical costs. There are plenty of ways in which we can approach trying to make sure that Medicare stays around for future generations and makes the program safe, one of which is negotiating drug prices. We've got some mechanisms in both Medicaid and in the Veterans Health Administration that help keep a cap on drug prices, but Medicare doesn't have as much flexibility in that regard. There's a lot of debate about how much money it would save, but I think it would go a long way towards preventing the type of situation I just described with that woman I read about in the article. So there are plenty of things that we can do to improve the program, but it does so much to keep people healthy, offers them preventative care, pays for hospital stays. There are some gaps in coverage, and of course, people are looking to the Medicare program because it's so efficient in terms of its administrative costs to be expanded to cover larger portions of the population. We don't have time to get into that in this video, but there are plenty of people talking about everything from lowering the eligibility age to 55 to simply increasing the eligibility sphere to everyone in the country. That's a conversation for another time, but Medicare and its protection is important to me. Just last year, as a part of a number of pieces of legislation, the Republicans in Congress were trying to cut $25 billion of Medicare funding out of, I think it's $702 billion or so that was spent last year. They're trying to take pretty big swipes at a very important, a crucial program that takes care of our senior citizens. And even though we didn't have time in today's video, I'm holding a series of town halls across the district. Please attend one of those and ask me questions about Medicare, and I'll provide you with all the detail that you would like. And I hope that stands in stark contrast to the types of responses we're getting to questions from our current representative.